afternoon and welcome to our webinar, Closing the Digital Skill Gap for the European Health and Care Workforce. And to some extent, I think this is a quite surprising title, because when you go in any given health system to a hospital or to a private practice, you see a lot of digital gadgets, you see the infrastructure, there's connectivity. So everything is there, but still we have the feeling the digital dividend hasn't come about. So what's going wrong? One of the things which is certainly going wrong is we're lacking the skills to use all these gadgets, all this infrastructure, all this connectivity adequately. And there are many stories from countries, even when it comes to the electronic patient record. And this is what we want to discuss today. So what sorts of skills are actually needed in the health system? Who needs these skills? And how do we get these skills into the system? For those of you who are following our webinars regularly, you may have already noticed that this is a second installment of a big project called BeWell, run by EHMA. It's an Erasmus Plus funded project. And 2 weeks ago, we were actually talking about the green skills necessary to reduce the carbon footprint of health systems. And today we are looking into the skills the health workforce needs for the digital. So it's not so much about the numbers, it's really about the skills, the competencies, and also the ambitions of people. And to discuss this topic, we have excellent speakers. We have my colleague Gemma Williams, who is the lead author of the policy brief on exactly this topic. We have Elisenda Reixach from Salut Social Foundation in Spain. She will zoom in on a case in Catalonia. We have Leah Martina from DG Santé. She's actually working for the Digital Health Unit. And last but not least, Federica Magheri from the European Health Management Association, who is the consortium lead of the BeWell project. So that's my little spiel to the beginning. And now a couple of things on the housekeeping. Please use the chat. Put in your comments, your questions, your suggestions, and we will feed this back at the end of the session to the panel. So the panelists will respond to your question. Please be reminded that we will record this session. There will be a lightly edited version of this webinar available on YouTube in a couple of days. So, and Erica, it's now your time to present the poll, but we also need to remind ourselves that we need to make an announcement at the end of the session. Please, Erica.
Yes, thank you very much. Lovely to see you all there in the chat box. I'll be popping back down there in a bit, but just a quick poll to see where we are with you as an audience. So first of all, do you believe that health professionals in your country have adequate digital skills to effectively use digital health technologies? Things such as electronic health records, telemedicine, AI diagnostics. And that's a simple yes, no answer. And then to get a bit more detail, what are the biggest barriers preventing health professionals from improving their digital skills in your country? So is it the lack of education and training opportunities, the training not tied to continuing professional development requirements, resistance to change by health professionals, technology is not implemented sufficiently, lack of time to undertake education and training, the cost of training, lack of institutional support, insufficient digital literacy, all of the above, or indeed none of the above. Really looking forward to hearing your thoughts there. Back to you in the studio, Matthias.
Thank you so much, Erica. And from the list you were just reading out, it's already quite clear that implementation of digital solutions is less straightforward than you would think, and that there's a lot of human factor in it. So that's my great pleasure now to give the floor to Gemma Williams. Gemma, please.
Thank you so much for joining today over your lunch hours. So I've got the pleasure of presenting a policy brief, which we've just developed as part of the BeWell project. We'll hear a bit more about BeWell later. So I'm presenting today on behalf of all of my co-authors that you can see at the bottom of the slide, and also on behalf of the BeWell consortium, who all contributed a lot to the policy brief. Any factual errors are, of course, my own. So the outline for the brief today, for the presentation today, so I'll just sort of briefly talk us through why we've written this brief. Then sort of the sections of the brief. So we looked at some new roles and new skills and competencies that the health workforce need to be able to use digital tools appropriately. Why is this brief needed? So the digital technology transformation is coming in society and in healthcare, whether we like it or not. So to use digital tools effectively, we have to make sure that our health professionals, our health and care workforce have the necessary skills to use all of the technologies they need to use for their roles. This can help improve patient outcomes, it can help improve working conditions for health professionals themselves, and it can help improve the overall efficiency of the health system. It can help build resilient health systems and support new ways of working. So in particular, digital tools can really support the implementation of integrated care and multi-professional teams. We need the appropriate skills in our health workforce so that digital technologies are used ethically and to make sure they align with regulatory requirements, both in the EU and in individual countries. And of course, we've got the European Health Data Space, which is being implemented. So health professionals are going to need skills to be able to use electronic health records, e-prescriptions, to be able to understand and know when to share data across borders and under which circumstances. So next slide, please. However, there are a number of challenges that stand in the way of health professionals having appropriate digital skills. So for instance, a 2019 OECD literature review showed that between 30 to 70% of health professionals reported that they lacked sufficient digital skills for their roles. So why might this be? So one of the big challenges for reskilling and upskilling the health and care workforce is big challenges of shortages and burnout. So this is especially since COVID. Most countries have shortages in their health and care workforce in some form. This leads to high workloads, this leads to increasing burnout and poor working conditions. This limits the time and opportunity and motivation that health professionals have to be able to take digital up and reskilling opportunities. Some of the challenges relate to technologies themselves. So the rapid technology is changing at a rapid pace, and there's much uncertainty as to what is coming in the future, what is going to be used, what technologies are going to be used in different countries, how they're going to be used. So particularly AI is advancing at such a quick pace. We don't know at the moment exactly how it's going to transform health systems or what type of skills health professionals are going to need. A third challenge relates to the general sort of the insufficient implementation of digital technologies at the moment. So some countries lack legal and regulatory environment for health technologies to be used appropriately. Financial reimbursement is perhaps not there to encourage uptake. For example, if health professionals want to do a remote consultation, are they reimbursed for it? Are they reimbursed at a suitable amount? Sometimes that's not being put into place or thought through. The organisation of work, are countries actually implementing multi-professional teams or not? Are there financial incentives in place for multi-professional working to be done or not? So all of this needs to be changed. The whole environment around digital technologies needs to be changed to encourage the uptake of digital skills. Next slide, please. So the EU has recognised that there is a gap in terms of the digital skills within the health and care workforce in the EU. And as part of this, they've launched a huge number of initiatives and funded a lot of projects, as well as developing the European Health Data Space. One of these projects is BeWell, which we'll hear a little bit more about later, so I won't go into these details. But one of the deliverables of the BeWell project was to develop this policy brief. And I spoke a little bit earlier about what we looked at in the policy brief. So we started by considering the new roles that would be needed as digital health technologies were implemented. We explored the core digital competencies that health professionals would need for their roles to be able to use digital technologies appropriately. We also assessed the status of digital education and training within the EU to identify some of the gaps. I looked at implementation barriers, so how these could be overcome to ensure health professionals could undertake the training they needed to develop appropriate digital skills. Next slide, please. And next, could you just skip through this slide, please? So we used just basically various methods in the brief, so predominantly a literature review, but we also did focus group discussions in 6 European countries, so Austria, Bulgaria, Germany, Italy, Norway, and Romania, to look at the implementation barriers. Next slide, please. So first of all, in the policy brief, the digital upskilling is not just about making sure the individual health worker or health professional has the right skills and competencies to use digital technologies. It's also going to transform our health and care workforce. So we're going to need new roles that aren't yet in place in most health systems. And when we were sort of looking at these new roles that would be needed, we saw that they could be divided sort of into 2 categories. On the left here, you've got the clinical digital roles. So these are really sort of the new roles and tasks that existing health professionals can take on to support the use and the implementation of digital technologies in the health system. So just to pick out one, for instance, a sort of a digital clinical safety officer. Most health systems already have a clinical safety officer, but they will change slightly as more and more technologies get implemented in the digital future, because now they will have to sort of look at minimizing the risks of digital technologies, assessing the impact of digital technologies, and ensuring the compliance of digital technologies with clinical safety standards and regulations. On the right-hand side, we have the technical support roles. So these are not for sort of existing health professionals. These are technical support roles that come in that most health systems don't yet have, or have, but perhaps not in sufficient numbers. So we need knowledge engineers. We need people who understand the entire health system, can help work out what technologies a hospital might need, for example, how it can be implemented, and how it is going to be used appropriately to improve patient care. We need cybersecurity experts. We've seen a lot of health systems in the EU in recent times come under cyber attack. Do we have enough cybersecurity experts in place that understand all the technologies, understand the health system, and can help prevent health systems from being hacked? So next slide, please. In the policy brief, we also reported on core digital competencies that health professionals need. And these are actually based on another deliverable from the BeWell project. And in this deliverable, they did a review of the literature, they did a review of existing competency frameworks, and they identified sort of 5 core competencies that health professionals would need to use digital technologies appropriately. I'm not going to go too much into the details, but please read the brief. So the 5 competencies relate very closely to the DigComp 2.2 competencies developed by the EU. And they are information and data literacy, digital problem solving, safety, cybersecurity, and GDPR, digital tools, content creation, and digital team building and communication. So this is sort of a high level core competencies that all health professionals would need to use digital technology for their roles. But I keep saying for their roles, just in recognition that not all health professionals will have to use the same digital tools. They will not have to use them in the same ways as other health professionals. In some countries, they might use different technologies in different ways to in other countries. Technologies might be different. What is important in one country might be less important in another, etc. This is all very context specific and all very role specific. So what we also see in the brief, and I'm not going to present today, but we'll see an example later, is that many regions or countries have already started to sort of look at what competencies are needed in their countries. How will they need to be adapted to their context, to their region, and how do they need to be adapted? What does a GP need versus what does a nurse need, etc. So this is a starting point for a framework, but they need to be adapted to the different contexts and different roles. So next slide, please. And next slide. So in the next part of the brief, we looked at the education and training opportunities that were already available in the EU. And I have to say, I was a little bit surprised that there are some major gaps in what we've got available at the moment. So one of the big noticeable gaps was that some advanced digital skills were lacking. So you might have quite a few training courses on how to use electronic health records, but anything sort of related to AI, to genomics, to training and robotics was essentially absent across most EU countries, especially when you come to sort of continuing professional development. We also had gaps for some professional groups. So whereas doctors, nurses had more training courses than for other professions, than for pharmacists, etc., even though they did exist. And again, these gaps sort of did change depending on the country that we were looking at. We also noticed there were big language barriers. So the majority of courses out there are in English. And this limits acceptability for many professionals who may not have English language skills to be able to undertake the training appropriately. There was also, in general, not necessarily a systematic approach for digital skills development in most countries. So there were sort of small ad hoc courses being implemented by some professional associations or some universities, but there were no linkages between them. It wasn't being driven from the top level, and it was all sort of very, very ad hoc. There were no links to CPD or accreditation requirements. So this is what we found, and they were the gaps that sort of needed to be filled. So next slide, please. And next slide, please. So that was what we found from the literature. And then once we'd sort of identified those gaps, we went and did some focus group discussions to see if those sort of the barriers to implementing digital upskilling initiatives were the same across countries and what other gaps might be. And from the focus group discussions, we've discovered that there were sort of 3 levels of where there were barriers to health professionals being able to take up digital upskilling opportunities. So the first was the macro level, and this came out of focus group discussions as being the most important level. So there was a lack of national policies and strategies in place. So as I said on the last slide, it was just, rather than ad hoc initiatives, many countries didn't have a clear vision in place. Running from the top down to the bottom, there were funding limitations. There was not sufficient funding in place to develop these training courses. So cross-sectoral working was not in place. So the health system didn't work with the education system sort of to develop these opportunities. And then at the MESO level, and the MESO is really sort of the organizational level. So we're sort of thinking about healthcare providers, perhaps professional associations as well in some countries. We realized that the organizational culture wasn't necessarily there to support on-the-job training, to support health workers having time off to go and undertake training opportunities. Perhaps leadership didn't play a key role in driving this forward or ensuring there were trainers in place in the health facility to support people to adopt new technologies. Resource allocation, budget sort of limitations perhaps limited the amount of funding that could go to digital upskilling opportunities. But of course, at the MESO level, most of these factors, or a lot of these factors, are shaped by the macro level. So if you don't have top level leadership, top level funding, that limits what the MESO level can do to support health professionals in undertaking digital upskilling. Then we also found there were macro level sort of barriers. Individual attitudes, motivation can sort of inform whether or not a health professional undertakes digital reskilling, upskilling. But again, that is largely shaped by some of the factors at the macro MESO level. So next slide, please. And just to sort of say, well, how do we overcome those barriers then? And I can see, I'm going to run through this very quickly because Matthias has appeared on screen. So what do we need? At the macro level, we need a clear vision, a clear strategy and funding for digital transformation. It's not just a small element of trying to make sure some health professionals have digital skills. We need to understand what we want in our health system. What technologies will we need? What are our goals? What are our aims? What technologies can help us meet those aims? Then how do we make sure we have every element in place to reskill our health and care workers? We need our strategies, legislation and funding. Then we need strong and future-looking education and training systems. We need to map out how our health and care workforce will change, what new professions will we need, how will they fit into the health system, how will we transform our education and training requirements, how do we put in place proper CPD, do we want accreditation systems, etc. And importantly, we need, I think this is going to be my last point for this presentation, we need to address the wider workforce challenges we face. The biggest issue to digital up and reskilling was the lack of time, the lack of motivation and the burnout that health and care workers are experiencing because of shortages. We need to put in place proper workforce planning to overcome those issues, to enable our health professionals to undertake digital up and reskilling priorities. So I'll leave it there. And I'll just say two final things. I think Frederica will speak about this a little bit, but we do have in BeWell, we've developed training courses that are online, and we'll put some links to the chat later so you can see sort of what BeWell have done to try and fill some of the gaps that we've identified. Over to you, Matthias.
Gemma, thank you so much for this excellent presentation, and also thank you so much for leading this excellent policy brief. And I think it will be extremely useful, because it's not just about, you know, what sort of interventions are needed, but also how to get them really into the system. So it brings both the skills and the implementation strategies together. And as you say, it's not just a fantasy of researchers or what the evidence says. It has also been worked with the social partners, and I'm quite sure that Federica will go into some detail on this one. But before that, I would like to ask Elisenda to take the floor. But first of all, Erica, fill us in on the poll. What happened?
Yes, quickly to give you the results of the poll. It seems a pretty clear thing that people in the audience feel that health professionals in their countries don't really have the adequate digital skills to effectively use digital health technologies at the moment. And in something which I found very interesting, because it echoes the finding of the focus groups that Gemma conducted as a part of the policy brief, time is the biggest issue. The health workforce just don't have time to do it. But a lot of the other issues are also pertinent, particularly the lack of training opportunities. So very interesting. And sorry, back to you, Matthias.
Erica, that relates quite a lot to the research process when we had the focus group interviews. I remember one country, we were talking to the leadership group of the health system, and they were saying, we have everything, but we don't train because we have a health workforce crisis, all hands on deck, no time for training. Yeah. Thank you so much. Elisenda, please take the floor.
So, well, I would just like to give a brief introduction that what is the company I work for, Fundació TIC Salut, no? TIC Salut Social Foundation. Is a public body linked to the Department of Health and the Department of Social Rights of the government of Catalonia. Okay, TIC Salut is primarily focused on facilitating the digital transformation of these departments, while also analyzing the potential applications of emerging technologies in the areas that you can see in the slide. Regarding the digital skills, we started this project 4 years ago. In 2020, more or less, the Department of Health commissioned Fundació TIC Salut to define a roadmap to improve the digital skills of healthcare professionals. And it was a need, actually, in fact, that was identified by the healthcare professionals themselves. No? So we started to work in this project. And we don't have enough time to explain in detail all the activities and milestones that we reach. But in this image here, you can see the general view, no, of the milestones that we achieve. No? Just to mention some of them, if you can see in this image, no, there are, for example, 2 strategies and two digital skills framework. This is because while running the project, we realized that the first hypothesis, or the first proposed strategies were not going to the right track, because we have done several studies, so the first strategy didn't work properly after some results that we obtained. So we changed the strategy, and we also changed the digital skills framework. Okay, you can see in the presentation also some relevant publications that they are in regarding the scientific papers that we have published regarding this topic, and some reports that we have written together with Estonia, with the Department of Health the Ministry of Health of Estonia. Okay, but because we also had a project funded by the European Community to share good practices between Catalonia and Estonia. So you have here some reports that we have written with them regarding good practices in Europe and related training and also digital frameworks. So if you go to the next slide. So in this slide, we actually show very briefly the results of the project. The results that we have obtained are, from one side, the digital skills framework. Also, we have proposed a training model and accreditation. okay, and a training itinerary. Regarding the digital skills framework, no, it's what it's shown here. It says dimension and skills. Okay, we have a document that is you can find it in this link in the image that explains properly the whole digital skills frameworks that we have defined. It's divided by 4 dimensions, and in total we have 11 digital skills that the healthcare professionals should achieve. Okay, if you look at these digital skills are quite similar to the ones that the Gemma showed. Okay, that they have found. So the full definitions, as I was saying, you can find them in this link here. Regarding the training model and the accreditation, what we have proposed for training the healthcare professional in Catalonia is that each of these digital skills, data protection, cybersecurity, etc., is transformed in a course. This course should last between 8 and 12 hours, more or less. The total training should be about 100 hours. And obviously, it has to be a training that has to be practical, contextualized to the healthcare sector, and free for the professionals. Regarding accreditation, it's important to motivate the professionals by accrediting these courses, and we have an authorized body here that they can accreditate this training. Therefore, the professionals, if they train regarding one of these competence, of these skills, they actually get some kind of certificate that they can use for their professional development. Regarding the itinerary, we have also proposed an itinerary, a training itinerary, which should be the digital skill they should start with. So our analysis, they should start with the digital skills like digital data protection and cybersecurity, and going on to the rest. This would be the most important part, the most important skills that they should start with, and it has a pedagogic reason behind it, but I will not go into detail. No, so but this is our recommendation, our suggestion that they should start the training for. And where we are now regarding these 11 training courses that we were talking about, no, these 11 digital skills that they are transformed to 11 digital courses. We have prepared some training content for 9 of these 11 digital skills. This training content has now to be revised that it's correct and that it's adapted to the healthcare sector in Catalonia. And we have to also develop the content for 2 of these 11 competences. And then we have to virtualize all these competences because we have already a platform in place where all the professionals, the healthcare professionals, have access. And once we have virtualized, we should set up the mechanisms to start to the training of all the professionals. And that will be all. Maybe I'm a bit too fast, but 5 minutes is not much. So that will be all for my side, Matthias.
Elisenda, thank you so much, and thank you so much for this very tangible and clear example. How to actually do it. And when you were presenting, I was reminded of Gemma's presentation. Also on the macro and meso level, how the leadership is important, that somebody's taking really responsibility for it, is pushing forward. So really great presentation and very good example to bring this forward. So fantastic. So we have now our next speaker.
So thanks again for the invitation. Thanks again for the opportunity to speak a little bit more about BeWell and this project that led then to the brief on digital skills that Gemma presented today. As you've heard before, the BeWell project is co-funded by the European Union and is a project that aims to respond to pressing needs of health and care workforce when it comes to green and digital skills. We will do so by developing a skill strategy for the entire health and care ecosystem. This, of course, will come in a year time. But as we are there, we also do want to make sure that we do train health and care professional and we ensure their upskilling and reskillings in digital skills. And to do so, the project has developed online training programs that are targeted at a variety of profession. So these includes training for nurses, for doctors, for pharmacists, for health managers, for public health professionals, but also for new emerging occupations. And as Gemma mentioned before, we did a number of actions to make sure that these trainings were relevant and were co-created. So we did a literature review, we did a need assessment in 6 pilot countries. And we did focus groups, but also a survey that was addressed to different health and care professionals. We received over 600 responses, and are these responses that led to the development of the competencies matrices that BeWell created that are at the basis of the training courses that we have developed. So these competencies matrices are covering a range of EQF levels, so European Qualification Framework levels, but mainly the levels 4, 5, and 6. And further to the matrices, we also collaborated with a number of universities, with VT providers, with social partners, medical societies, or any other group representing professions to build training programs that were really relevant and responded to the needs of the workforce. And these trainings are currently available and in pilot phase. I think that the link is being dropped in the chat, so you're more than welcome to go and check them out. They are in English and in other European languages. And they are fully free of charge for you to pilot and test. So these programs aim to address a digital divide that we do have in Europe. Of course, you're all aware that some countries have a higher level of digital skills, some others lower. And this divide is also not just among different countries, but within countries and within regions. And so with these in mind, we also wanted to develop a suite of courses that really responded to these diversity. And we developed courses that really focus on foundational digital health literacy, but also a little bit more advanced competencies so that we can provide really a wide array of opportunity for different digital skills levels. So let me give you just a few examples. Apologies. When it comes to the foundational skills, one example is a course on increasing the Microsoft and the Google Suite knowledge. This is a course that has a lot of practical examples and a lot of practical exercises to really get these foundational skills in place for health and care workers. Another example of foundational skills course is the course on cybersecurity for healthcare staff that addressing topics such as cybersecurity, GDPR, password security, and so on. And this is mostly addressed to nurses, administrative staff, but again, really applicable to everyone. And if we look at the more advanced competencies, some of the courses that we provide through BeWell is data analytics with R, so how to implement and run machine learning approaches using the open source platform R, or healthcare ICT, that is especially designed for medical technicians, and covers topics such as the electronic health records, the benefits of the digitalization, or managing clinical data with radiology information systems and picture archiving and communication systems. And last but certainly not least, we're also launching another batch of courses that will be available I think next week already, for you to pilot, which are focused on the next generation green and digital skills. And so these are really courses that focus on new emerging occupational profiles and are designed to enhance digital literacy with a specialized focus on the digital competence that will be needed by health professionals to make them well equipped for upcoming trends in the digital health landscape. And just to really conclude, I also want to mention that besides the courses developed by the BeWell project, the BeWell project also developed a skills monitor that collects over 100 training opportunities in digital and green skills. These are training opportunities from across Europe and the world. These are very different type of trainings addressed to different professional profiles, but they are there for you to consult, to look at, and to be more aware of what is present out there. And with this, I conclude. Matthias, I hand over to you.
Federica, thank you so much. Lucy, can you switch on my video, please? I think it has become very clear, Federica, that BeWell is a super, super complete project, because you have the analysis, you have the conceptual framework, you have the categories in which you define the skills in the matrix, you have the training program, and now in the very near future, you are going to develop policy guidance actually as well. So everything is there, from the science to the implementation side. So thank you so much, Federica. And I hope that people are having a look at the websites and the links, and also the policy brief. And now it's my great pleasure to invite Leah. Leah, you can see I couldn't hold back, I wanted to have you instantly, but now we are looking forward, and especially since you are from the unit which is dealing with digital health in DG Santé, we are very, very keen to hear about your views on all of this. Thank you so much. Please, floor is all yours.
Thank you, Matthias, and thank you for inviting the Commission to speak at this webinar. It's really, really great to see that the EU-funded project BeWell is delivering this important policy paper of digital skills in the health sector. And it's not only you, but it's also me that I'm really, truly excited to be here and to share the new developments related to the European Health Data Space regulation. I will just go with HDS, if not I take 2 hours. Improving digital skills among health professionals really couldn't come at a more crucial time. The HDS regulation was officially published in the official journal on the 5th of March and entered into force on the 26th of March, so really just a couple of weeks ago. And this regulation marks a global first. It's really the world's most ambitious and comprehensive legal framework for health data governance. So the regulation, what does it do? So it sets out clear, enforceable rules on how the health data can be accessed, shared, used, but also reused for primary care, for research, and for policy. At its core, the HDS is about unlocking the value of health data for individuals, for professionals, for science, for policy. So it's really important. I would like to pass this message that the HDS is about giving a bigger purpose to health data. But in practical terms, so why is it so important for the community? So for patients, it means access to their own data. It means full transparency and control, including the right to choose who can access their data, and also restricting access to some information. So you can see that the HDS is a tool for empowerment. For healthcare professional, it means timely, secure access to the relevant information for emergency care also abroad. This is really important. So if you are traveling abroad and you feel sick, you go to the hospital, the doctor can access all your information in their own language. But also, of course, is important for the patient care at home. So the HDS improves the safety and also reduce the duplication of analysis. Just imagine that you have access to all the data of your patient. You don't have to duplicate. And this means that also the efficiency is better. For researchers and innovators, the HDS means that they are finally being able to discover and request the data without facing many different legal regimes. There will be only one. And for industry, it ensures fair competition without giving the big players an unfair advantage. And for member states, it means better capacity to monitor public health, allocate resources, and plan for the future. And the COVID pandemic showed us just how essential all this is. So, especially in Sante, we are celebrating this big achievement, but we also need to recognize that this is only the beginning. Now we are entering the implementation phase. And that's where your role and developing strong digital skills becomes absolutely vital. So yes, the incentives are real, but we also need to be honest that the HDS is really ambitious and that there are challenges that we must overcome. The systems, they must be interoperable, but also usable by clinicians in busy hospitals, by researchers that don't have a lot of time, and also by patients with diverse levels of digital literacy. So that's why developing digital skills across all this group is super important. And we are co-developing tools with users and experts across Europe, so not just imposing top-down. And I really hope that the BeWell will continue to provide us important policy feedback and we can create synergies between the different initiatives. So the key message for me today is that the Commission can support the implementation of the HDS, but we cannot deliver alone. So we need to continue developing digital skills in the health sector. We all have a role to play in shaping this transformation for your country, your community, and for Europe as a whole. So thank you so much for having me today.
Leah, thank you so much. And I think from your presentation, it's crystal clear. Number one, we all need to familiarize ourselves with this new framework. It's very important because this will pave the way for digital solutions in the future. And number two, it shows how relevant BeWell is because we need to get this knowledge, on the regulation into the system. And for this, we need training systems, continuous professional development, as Gemma has told us, but also as we have learned from Catalonia. So thank you so much, Leah, for this input. And that's the moment where I would like to ask Erika to come on board, because I think we had a quite lively chat box, didn't we?
Yes, very lively chat box. I'd like to give a shout out to our colleagues in Serbia, Hungary, Portugal, Australia, EMRO, Georgia, Moldova, and Ukraine for joining us today. But some quite interesting, quite technical questions coming up. People are making the point about how a lot of the digital innovations are designed by technical people and managers to meet their needs without actually real input from frontline staff. So
not so familiar.
Yeah, so familiar, isn't it? So I suppose the question there is, like, how do we bring the frontline workers on board? Are there any top tips for this? Are there any really good examples of this working in practice? Also to do with, and this is probably quite a specific question for the BeWell colleagues, is there a chance to have these put together in almost like sequencing the courses so that you can work through them like milestones, like we have for the Catalan courses that Elisenda was describing? Are there any examples of these new digital skills roles, any country examples of these that we could share with people? And I suppose the big question, how do we find the time? That's the big constraint here. So how do we find the time? Okay, I'll come back for a second.
Just pick out the question you feel best suited to respond to. And shall we start with Gemma, Erika? Gemma, are you ready?
Yep, I'm always ready, Matthias. So I think I will take, so the question first of all about sort of examples of a country that might already be sort of looking at the new roles, implementing the new roles. I'll just take, I know it's outside of the EU now, but England actually sort of started this exercise of sort of trying to think about the new roles that would be needed in the health system to help implement the digital transformation back in 2019. And they released something called the Topple report. And in that report, it sort of looked at the different technologies that were coming in, how it would change the composition of the health workforce, what sort of, you know, new skills certain health professionals might need to take on board, and the timeline for this. So it had a really nice figure, I remember, saying, you know, electronic health records, you know, the majority of health workers will need to use these within the next 5 years. So therefore, you need to think about your training, putting that into place as soon as you can. Then it was AI or genomics. It won't necessarily be needed by all of the health workforce, but it will be needed by some of them in the next 10 to 15 years. So then think about sort of how do you get the education and training in place over a slightly longer time period. So that was quite an interesting exercise, and sort of I would recommend that, and in the policy brief, we do suggest that countries do sort of take a look at their specific health system, their aims, their goals, what technologies can help them meet those aims and goals, and how and when technologies might come into place and which health professionals it will affect.
Gemma, thank you so much. And I think that's a super important insight. You've been mentioning that we need to be prepared and prepare the educational system, that the composition of the health workforce is changing. And I think this is a misperception. Many people think we have digital that makes my life easier, but it's not only making the life easier, it will change the workflow, it will change the ways of working, and people need to accept this, otherwise we will not get a digital dividend. Thank you so much for this. Elisenda, you're muted. Happens to all of us today.
Yeah, sorry about that. No, I would just like to say also that it's not just about the training, upskilling, no, the professionals from today, but also the professionals from tomorrow. Okay, so what's going on in the universities? No, the universities today have actually digital skill courses aligned, no, with the healthcare systems. So my project mainly it's focused in healthcare professionals, active healthcare professionals, no. But for example, Estonia was actually more focused in training the professionals of the future, because even sometimes we say that they are this new generation, they actually have the skills, digital skills, because they have born with a tablet, no, on their hand. That's not true. I mean, digital skills not just about using technology. It's also attitude, no. It's also it goes further, that to know how to use a tablet or software itself, no. So yeah. I would say that we have also to look at the professionals of the future.
Yeah, Elisenda, can I ask you something? Leah was very explicit how important the European health starter space regulation actually is, and you're so advanced in implementing digital skills. Actually, do you see the opportunity? Are you already training the new stuff, the new people in the health system on the regulation?
Well, for example, my entity, it's also the data protection officer of the whole healthcare system. So they actually prepare courses specific for the entities, no, the healthcare providers. I'm not sure if specific from this the European data space, because that's not something that they have to know all the professionals, no. So we have to also be aware that not all the professionals they need. I mean, they need a general base knowledge, a general knowledge, no. But for example, in terms of some specific topics, maybe it's not necessary that some profiles, no, or some professionals that they are never going to interact, no, with. Maybe they need to know the definition, no, what is it, no, but not to be really trained in something that they are never going to be using.
Very good, very interesting. Federica.
Yeah, thanks, Matthias. I was quite interested by the question or the comment on the involvement of frontline workers. And I think I can speak on behalf of the BeWell project that we really made of co-creation the cornerstone of the project. For us, it was and it is really important not just to produce some trainings or produce a strategy, but really speak with those that are the beneficiaries and those that will be needing the skills. So completely agree on the need of developing and involving the frontline workers. These can be done through co-creation. We know that this is quite difficult because of lack of time, of course, and because of a number of other challenges. But these also comes with strong leadership and with the roles of managers. There must be an effort to empower their staff and to make sure that they are involved and engaged. And I would also recommend that this is it's a triple approach. So there are, of course, the manager, there are the technology providers that can give the specifics of the technology that is going to be implemented, but there is also the education provider, so that this creates a sort of a circle where the education is tailored to the technology that is tailored to the settings where the technology is implemented.
Thank you so much, Federica. And I can tell you that we got a little bit of flavor of co-creation, especially Gemma was exposed to it, leading the policy brief, and you have dozens of stakeholders and other people commenting on it and reviewing it. So it's quite a cumbersome thing, but I can only congratulate you that you come so far with this project, Federica, because I think it's a really big achievement. Leah, please.
Yes, thank you. So I would like to highlight the importance of this topic in relation also to the regulation. So we have specific articles in the regulation 82, 83, and 94, where we explicitly recognize the need of capacity building programs, training programs, improving digital health literacy, and the Commission will help the member states in creating all this knowledge to understand even what the HDS is, because in this specific moment the regulation just entered into force, so it's still a bit not everyone knows, and especially health professionals. So we are also preparing communication toolkits to really even do the first step, so raise awareness, and then also these trainings will come. And just maybe a positive example, so currently the infrastructure My Health at EU, that is the infrastructure that permits the cross-border exchange of health data for primary care, is already actually up and running since a couple of years, because it started as a voluntary infrastructure, and we have really successful capacity building programs where we twin the member states. So member states that are more advanced, for example, in digitalization, can teach other member states that are learning, and this was really a big success of mutual learning. So just to give a bit some examples.
That's fantastic. Thank you so much. But I think what Elisenda said, and actually it came also from Gemma's presentation, not everybody needs to know everything. And it will be really necessary that in countries and organizations, some people make really decisions, what need to be taught and what need to be absorbed and what can be left to the technicians or the specialists. So thank you so much for this. Erika, we just have 4 minutes left. Just a very quick thing before Gemma wraps up, and then we have an announcement to make.
Okay, so lots of questions came in at the last minute, which is a real shame, but two big questions. One is, how do we match this up with patient digital literacy and the role of patient digital literacy in supporting communication? But also monitoring and performance, as ever. How do we know that these training programs are actually working? So
go first.
Shall I jump in?
Yeah.
Just with the monitoring. This is something we've been talking about a little bit, isn't it, Federica? Is how sort of now that the training courses are developed, how do we monitor, the uptake and the effectiveness of them? And it's proven to be, you know, quite a challenge, but it is something that we're working on, and we hope to sort of potentially develop something on it going forward. But it's really important. And I think as well, actually, this links a little bit to the co-creation, the co-design.
Yeah.
It's not just co-designing it, it's once it's implemented, how do we then keep track of, you know, once is it working? Are all health professionals, is it helping them improve their work-life balance, etc.? We need continue monitoring, continuing quality improvement, etc. Those processes need to be in place, and we need to think about how to develop them properly.
Excellent. The health literacy question is also very interesting. Elisenda, we know that the health workforce is much bigger than the professionals. Parents, family members, neighbors, they all help, you know, they provide a lot of care. And in this digital ecosystem, you know, we need more and more skills, literacy, health literacy, digital health literacy. Are you doing something in Catalonia for this?
Well, in that regard, it's not in my table, but I'm aware of a project that is being carried out by the Catalan healthcare system, that they have actually categorized patients regarding their digital skills. So our idea is that we have some technology implemented so that the patients can decide if they want, for example, if they want to contact their GP, no, by email, no, with a platform that is completely protected, no. So what we need to put there for the patients is the technology for the ones that they want to use the technology, and the ones that they don't want to use the technology, we have to help them to use it, but at the same time, give them the care that they want, no? So if someone doesn't want to use the email to contact their GP, they don't have to, okay? So, but regarding roles, I was the other day in a conference, and they were talking about, for example, that it could be also generating new roles, no? In the primary care centers, we have primary care centers, is that, so there it could be someone who could help patients, no?
Elisenda, we're running out of time.
I
need to give Federica and Leah very briefly the floor. Please, very briefly, Federica, one sentence.
I will be extremely brief. I really subscribe everything that Gemma said. I think it's important to have continuous monitoring, and I think that co-creation doesn't just stop there, but it continues later on. So I will stop it right there.
Leah.
Yeah, maybe from the policy, we can say that we have a stakeholder forum, and in the future we will have a stakeholder forum for the HDS to make sure that we are always in contact with the patient associations and all the stakeholders involved to make sure that the policy aligns with the needs.
Perfect. Thank you so much. Gemma, would you like to wrap up one or two sentences, you know, the take-home message from all the work?
Yeah, I mean, I think the take-home message is the digital transformation is coming. It gives us such a huge opportunity to transform our health systems, make them cost-effective, and improve patient care and improve the workloads of health professionals. But digital technologies need to be implemented properly, and health workers need the skills to be able to use them properly as well. So we need to work out how best to do that in our region and our countries.
Perfect. Thank you so much, Gemma. And now, Erica, it's time to make a little announcement for next week, isn't it?
Yes, it's European Public Health Week next week. So I look forward to seeing you all here. We actually have 3 webinars coming up. Do check out our events page. But the first one is on Monday, 12th of May, and it's Strengthening Resilience, Innovating and Reforming Primary Care. Great lineup, as you can see, and I look forward to seeing you all next week. Take care now.
Very good. Thank you so much. Bye-bye.